Good afternoon, dear colleagues. Thank you for sharing this lovely honor with me to be part of this year's edition of IMCAS Asia and to visit this nice, beautiful country. My name is Dr. Paula Luzanova. I'm a dermatologist and a maxillofacial surgeon. I come a long way to here. It's my home country is Bulgaria. And you can see that it's a nice place. It's not that big country. It's situated in the southeast of Europe. We are really famous with not only our beautiful nature and culture that has been passed through the generations, but basically we are mostly famous with our beautiful, colorful dancing. This is the national folklore dancing, and it's very important for, as you know, for the dancers to be simultaneously beautifully moving together, so that at the end we have a betterness and beautiful dance. So the concept for the better togetherness is the idea of my talk today, which will be combining threads and polylactic acid, sometimes in one session and sometimes in different sessions, regarding the outcomes that we would like to achieve. With my really great team, we've been working on this protocol for some years now. And today I will share a couple of indications and some nice results that we obtained. So, as we like to call it, it's the body hybrid lift rejuvenation. We use it also on the face, but now in context of body rejuvenation, we will be speaking about only that. It's the combination of polylactic acid collagen stimulator, which is injectable, in combination with PLLA PCL threads. It's anti-ptosyl threads, 24 centimeters long. We use it in one session or separate sessions, depending on the clinical outcomes that we would like to achieve. So yes, we have the lifting, the volume restoration, the skin quality, and the immediate and long-lasting results. So the abdominal area, a really hot treatment zone to be targeting. We are using lots of the ultrasound nowadays because we like to be as safe as possible. In this case, we have a young lady. We decided to start with the polylactic acid fillers for starts because she was suffered from surgery because she had a hernia in history and she has an implant. You can see that we are doing our entry points, just anesthetizing them. We are doing undermining and placing some nice dissection because we want to keep her safe, and this is what we are doing first before introducing the polylactic acid. In her case, we decided to start with the PLLA, and then when she obtained some skin quality, then this is the right idea to combine. So on the second session, we will do threads. But you can appreciate that this is the before. We waited 4 days after for the PLLA to take some activity. So you can see that there is some nice projection of the collagen. Already the skin is becoming more vivid. Don't forget that this is not surgery. Of course, it's the most natural result that we are achieving, and our patients should be really happy because they want to be healthy and better. So this is the side view. You can appreciate that it's beginning to be active. How about this next case? Here is the suitable candidate if you would like to do the so-called hybrid lift in one session. You can see that this deformity up on the umbilicus area is really a bit depressed. She's really sports active lady, so she's doing lots of sport activity, but she's not happy at all with her appearance of that zone. So this is what we do in one session, the hybrid lift technique. We are using the PLLA. In that case, we didn't do any undermining because she wasn't in need of it. We placed the PLLA, and then we did the vectoring with the threads. It's a special 25 centimeter threads for the body. It's PLLA PCL threads. This is the before, and this is quite a long-term follow-up. Just one session, combination with threads and polylactic, and you can see that it's become more even. Another good idea to use this technique is when you want to achieve good results on the upper portion of the abdominal area. Again, it's not surgery. The idea is to beautificate and to obtain some firmness of this zone. So yes, this is before and 8 months after, just one session, placing the threads and the polylactic together. Again, another case before, this is immediately after, before, and 2 months later, 6 months later, still a good effect. She was so happy that she even put a piercing on her belly, and every time we are making fun with this. And this is the long-term follow-up. So yes, the longer the time passes, the better the results are. And don't forget, it's only one session with short minimum downtime. We have some, of course, good ideas to give to the patients to how to keep themselves safe after the procedure, but it's not that long as downtime. So how about the new phase in aesthetics, as we call it? This is the buttock area. This is a really hot topic now in our country, not only in our country, but I guess worldwide. We are doing the hybrid technique by repositioning. First we place the threads and then we put the polylactic acid because we want to have everything in just one session. We want to reposition, we want to have good volumizing capacity, and we are really insisting on the antiseptic, of course, technique. We are keeping the patient safe so that everything will be quite fine. It's really sterile. Once you're on the body, you are always, it's really mandatory to keep it safe. So this is the same patient. This is just one session, firstly before, 4 months after the hybrid lift, and then we placed one session only PLLA, and this is 9 months after, sorry. So you can see it's becoming more volumized and more shaped. This is the idea, to be beautiful, but not to be overcorrected. Another case is before, immediately after the hybrid technique. You can appreciate the side view here and the elevation. Of course, the immediately after is more like more a show, but you can see that the magic actually takes time and it's happening later on the time it passes. 18 months after, you can appreciate that it's a nice stable result. Again, another lady before, 16 months after, long-term follow-up and nice results. Just one session again, threads and polylactic acid before, 1 year after. Again, one lady younger, not that so sportively active, immediately after, 6 months after, you can appreciate the volumizing effect. We did for her the hybrid lift for the beginning and 3 more sessions with PLLA, so it takes some time, and you can see, sorry, this is the 2 years follow-up. It's stable result, and of course, we didn't do anything for more than 1.5 years because she was happy, and you can see that with this type of procedures, it takes time, but the effect is really stable, and it's really good. Another lady, we all know that now there is a new group in our aesthetic practice. Those are the Ozempic users. So this was a lady that suffered really extensive fat loss, more than 20 kilos. And she was really unhappy with her appearance. This is the before. This is immediately after. We decided to start with the hybrid lift. So we placed the threads with the polylactic in one session. We waited for 1 month. And we waited for 2 months just to make sure that we give her the time to see how she will react and what the volume will be. And then on second session we did, which was 3 months after, we did another polylactic acid. And now is the time to say that once you are in your nice practice and you keep good communication with patients, once they're happy, they're going away. She didn't come to make a photo, of course, but remember, if you ask for a selfie, you might be getting a belfie. So this is something really funny. She sent us this photo, and you can appreciate the nice skin quality and the nice projection, and actually she's really happy. So how about this patient? This is the worst patient because this is a patient that was abused by surgery many times, obsessed with her looks. She lost too many weights. Again, we have a history of Ozempic intake. And this is the aspect. Lots of liposuctions, lots of skin-reduced surgery. We decided to treat. We started with the hybrid. This is 2 months after. You can appreciate that something is going on and it's getting better. And this is 6 months after we did another session with PLLA. Of course, it's not magic, but she was really happy with the effect. Another lady, just one session before, 6 months after, again the hybrid, and 1 year later. You can appreciate that it's getting nice and firm with time. So don't rush it and don't hypercorrect. Wait. This is the before, another lady, really sportly, active, really beautiful, but she was a bit uncomfortable with her buttock area, so we did one session, hybrid, 12 months after. Again, this is actually a really nice lady. She's really tall, she's a model, and she's really, really unhappy with the things that are going on with the physiological process of aging. So we did one session, this is 1 month after, and 7 months later. So until now, everything was good, but what do you think about this situation? This is a lady in her late 50s. She doesn't like any sport. She's like the worst patient ever. She doesn't want to eat, she doesn't want to move, and she wants to be beautiful. This is real life. So we decided to start. It's a really bad skin quality. We placed the PLLA, of course, because she was not suitable at all for threads. We have to have skin quality to be really good candidates. So we decided, and this is 1 month after already the first session of the PLLA, and this is the photograph of the second session in combination with the threads. So she was ready already to receive. We did third session, only PLLA, and this is 18 months after. You can see that actually it's a dramatic change. She came to our office and she said, I don't see any change, nothing is happening. But you can see always photographs are really important because they are the ones to show that the patient is actually really, really nicely done. Upper arms, another hot topic. This is the before. The skin quality is poor, so yes, we start with the polylactic acid to obtain some skin quality. 4 months after 3 sessions, we waited 2 more months, and then we placed our threads. Again, we are doing it really comfortable under local anesthesia. We are using the threads that I already mentioned. They are really nice once you have a skin quality, and the stable effect is really good. So you're able to reposition, but you have to have what to reposition. So always remember to start with the skin quality first, and then play with the repositioning. So this is the before, and this is 12 months after. Another case, similar. Poor skin quality, upper arms. This is after 2 months after the first session with PLLA. Then we placed the hybrid again, just 1 session with threads and PLLA, and this is the 12 months after. It's not surgery, but for this type of indication, it's really nice because the patients are more comfortable and happy. So this was another idea that we came up, and we are working really actively. So hopefully next time, if I am invited again, or if I invite myself, to be quite honest, I will show you my ideas of combining the ABDs with threads and polylactic, because it's all about combination. Remember, we are better together. So this is the before. We did for her radio frequency that we are using very actively now. It's subdermal device, monopolar, and this is 6 months after we did this combination, 2 sessions of PLLA and the threads. And with this, I would like to thank you all for staying so late. We appreciate